Millions of Americans have type 2 diabetes and millions more are in danger of getting it. So joining us now to talk more about the risk and prevention is WebMD's Chief Medical Officer, Dr. John Whyte. Thank you so much for being here, Dr. Whyte.
Great to be with you this morning.
So first, talk about the difference between type 1 and type 2 diabetes.
So type 1 diabetes is known as insulin deficiency. So typically it occurs early in life because your pancreas isn't making enough insulin. So you're always going to require insulin to stay alive. Type 2 diabetes is what's called insulin resistant. You're still making insulin, especially early on, but your body, your cells have become resistant. They can't get the glucose into your cells for energy. 90% of type 2 diabetes is caused by obesity, and that's why we know you may be able to reverse it.
So if someone is diagnosed with prediabetes, does that mean they're going to get it for sure, or can they take steps, and what are those steps to reverse it?
You know, in general, about 10% of people with prediabetes progress to diabetes every year. And overall, it's typically been about 70% throughout their lifetime are going to develop diabetes. So that's why I wrote this book, Take Control of Your Diabetes Risk, to give people tools and resources to help prevent that progression. Or what I'm talking about is reversal. Because years ago, we would say, oh, once you had prediabetes or diabetes, you're on your way to the complications of diabetes, heart disease, blindness, challenges with your kidney. But now we know that taking certain lifestyle changes early on, especially when you're diagnosed within those first 3 years, can put you on the road to reversal of type 2 diabetes and prediabetes.
So I know you talk a lot about the common myths and misconceptions about diabetes. So my mom has type 2, my grandmother has type 2, my great-grandmother had type 2. So is this genetic? Am I going to get it, or is that a misconception?
Yeah, it is a misconception. There is a genetic component to type 2, but it's very small. What I've seen over the years is that when you have a family history, it's usually because you share some of the same behaviors in terms of your diet, in terms of your activity, in terms of, you know, your stress level within a family. So what I would say to you is if your family members have type 2 diabetes, then it's even more important to empower yourself with good information, with quality information that's going to show you the steps to reverse it, or at least prevent complications. Some people are going to need medication with type 2 diabetes, but sometimes as doctors, we're too quick to put them on medications. And what we really should be talking more about the lifestyle changes that people can make.
And what are the risk factors that you want people to know?
What I want people to know and talk about and take control of your diabetes risk is that if you have diabetes, you're more than twice as likely to have a heart attack. You're more than 3 times as likely to have a stroke. Diabetes is the #1 cause of blindness in the United States. It's a frequent cause of kidney disease. So if you're at risk for diabetes, you're going to want to do everything that you can in terms of reversing it, or at least preventing it. And that is about what you eat, what you drink, looking at labels and recognizing that even when you think foods are healthy, like yogurt, it still could have a lot of sugar. You know, pasta sauce has 8 packets of sugar in some of them. So you really need to start looking at labels, informing yourself about healthy lifestyle. You know, in the book, I talk about, you know, here's a meal plan that you can use. Here's a 4-week exercise program that you can try. Because if you make these changes, losing 7% of your body weight, you often can return your blood sugar to normal.
So you wrote a book about this. Why are you so passionate about raising awareness on diabetes?
Yeah. You know, I've been seeing patients for more than 2 decades, and all too often I've seen the complications of diabetes, those issues of blindness and kidney disease. And really, people can make lifestyle changes to reverse it, to not to have to be put on insulin, not to have those complications. But there's a lot of misinformation out there, and people get confused. So they're like, well, what do I eat, Dr. Whyte? You know, what type of exercises should I do? So I really wanted to curate all this information, you know, in one source, in one book, that really empowers patients with the information that they need to take control of their diabetes risk.
And Dr. Whyte, where can people get your book?
You know, they can find it on Amazon, Barnes & Noble, and wherever books are sold.
Wonderful. Dr. Whyte, thank you so much. We appreciate it, and thank you for what you're doing to raise awareness when it comes to diabetes.
Thanks for having me.
Thank you. Have a good day.
You too.